Rochelle Walensky, she is now admitting that there is a difference between hospitalization from COVID and with COVID. So many people were pointing this out last year, that every time somebody died, the question should have been whether they died from COVID or with COVID. Because if you were 90 years old and you had leukemia, and then you died and you had COVID because they tested you, did you die because of the COVID or did you die because of the leukemia? And it happens that you had COVID at the time. And we were told you're not even allowed to ask these questions. Well, now that the cases have spiked, there are a lot of people in the hospital, particularly children, who are in the hospital not from COVID, but with COVID. There are a lot of kids who are going to the hospital with, say, flu or RSV. And then they are also testing positive for COVID, which means they're not there because of the COVID. Rochelle Walensky was asked about this. She says, oh, yeah, we're gathering stats on that now. Weird that you guys didn't bother gathering stats on this over at the CDC over the course of the last 2 years.
Do you know how many of the 836,000 deaths in the U.S. linked to COVID are from COVID, or how many are with COVID, but they had other comorbidities? Do you have that breakdown?
Yes, of course. With Omicron, we're following that very carefully. Our death registry, of course, takes a few weeks to collect. And of course, Omicron has just been with us for a few weeks, but those data will be forthcoming.
Oh, those data will be forthcoming. I'm glad that you're collecting them now. Weird that you haven't collected them over the course of the last 2 years. And when you realize what it is that the CDC has actually spent money investigating and what they have not spent money doing or investigating, it really is incredible. So we've had all sorts of studies from the CDC about racial disparities in treatment of COVID. But how many studies have we had about the actual level of antibodies in the general population early on? Like, how many people have actually had COVID? Do we even know that? Why wasn't the CDC doing any of that? Why was it left to private people in like Santa Clara County organizing private studies as to exactly how many people had gotten COVID? How about the CDC stats on how many people have gotten this via transmission on airplanes? The CDC has provided no data, like the most practical aspects of this virus. The CDC has ignored the entire time, instead pursuing specifically political questions. And now that the politics of COVID have shifted against the lockdown fanatics, now all of a sudden they're like, you know what, maybe we should check out how many people died of COVID versus with COVID. It is incredible how much our public health establishment has blown itself out. The story of the last decade in American politics is every major institution in American society destroying its own credibility on the shoals of politics. It really is unbelievable. Everything from the AMA to the educational institutions of our nation to the CDC, like every single area that of institutional trust has been decayed, not by skeptics from the outside, but by people from the inside who, in order to fight those skeptics, have completely undermined all of their credibility and trust. It's absolutely insane. By the way, Rochelle Walensky admitted over the weekend, the killer app when it comes to the Joe Biden vax mandate. If the vax does not prevent transmission, there's no reason for a vax mandate. And the entire basis for a vax mandate is that you have to keep the unvaxxed away because the unvaxxed can infect the vaxxed or something, or they can infect each other. You don't want that happening at work. And that is the entire basis of the vax mandate. But if the vaccinated can also pass COVID, that is completely irrelevant. Here was Rochelle Walensky last night admitting that the vaccines don't actually stop transmission, which of course we all knew since all of our friends are getting COVID no matter how many times they've been vaxxed.
Our vaccines are working exceptionally well. They continue to work well for Delta with regard to severe illness and death. They prevent it. But what they can't do anymore is prevent transmission. So if you're going home to somebody who has not been vaccinated, to somebody who can't get vaccinated, somebody who might be immunosuppressed or a little bit frail, somebody who has comorbidities that put them at high risk, I would suggest you wear a mask in public indoor settings.
Okay, so forever, presumably, because Omicron is now an epidemic. I mean, it is now endemic, rather. Omicron's everywhere. So presumably for the rest of your life, it is just going to be a risk that is out there. So I mean, they've gone completely crazy. I mean, I have a 98-year-old grandmother, and my 98-year-old grandmother is in a facility, an assisted living facility. She's older, and they have locked her in her room, like full-on locked her in her room. It doesn't matter that she's been exposed to COVID 25 times over. They've now locked her in her room, even though she is not immunosuppressed. Like, at a certain point, you're just going to have to let people live because this is what it is. That is the end of the story. At least people should be given the choice as to whether or not they are allowed to see other people. It's totally crazy at this point. I mean, even Brian Stelter is mocking the CDC. Here's Brian Stelter over at CNN going, oh, wait a second, the CDC's bad at its job. So I thought this is questioning the science. I thought that if you mock the CDC or made fun of anything the CDC says, this is questioning the science. Apparently, you're allowed to do so now. So it's open season on all of the institutions that we were banned from even criticizing on social media for the last year and a half.
Here's the Today Show. Here's Savannah Guthrie interviewing the CDC director, being very much in touch with the public, recognizing the CDC has turned into a punchline. It is so sad, but it's true. The CDC has turned into a punchline. Watch.
All of this mixed messages or new messages has led to a meme on social media poking fun at the CDC's advice. Tweets like CDC now recommends eating straight off the floor at Waffle House. The CDC now says it's in fact okay to eat Tide Pods. The CDC says go ahead and get bangs. You know, it's amusing, people letting off steam, of course, but is there a larger credibility problem with your agency right now?
And the answer is yes. There's a huge credibility crisis.
I don't know when Tucker Carlson inhabited the body of Potato Brian Stelter, but apparently that's a thing. Now, by the way, CNN is now reporting that Rochelle Walensky, who's been terrible at this since the get-go, right? Many of us have been criticizing her for being terrible at this since the get-go. Rochelle Walensky apparently is now in media training. Like, she literally has to have people come in and explain to her how to do media hits, which is kind of incredible for somebody who's the head of the CDC.
CNN has learned Dr. Walensky is in media training. For months, she's been meeting with a consultant to improve communication skills. The well-regarded infectious disease expert had no government experience before President Biden appointed her and has often seemed out of step with the White House and Dr. Fauci, leading to some abrupt and confusing changes in guidance. Now, Walensky's under fire for not following the CDC's own playbook for explaining new guidance. A Biden COVID advisor tells me the CDC has got to do a better job communicating what they're doing and why, and that has to happen quickly.
Okay, my favorite thing here is the president of the United States being the CDC. They're really bad at comms. That's Joe Biden's White House. Joe Biden is not even alive. His comms consists of him stumbling out to a podium, saying several sentences in a row that seem to take the form of sentences, but don't actually have words that make sense in them, sort of like a Lewis Carroll parody of grammar, and then stumbling off the stage before taking any questions. He's like, oh, we need to get Rochelle Walensky some media McTranimage. Man, you know you've blown it when Joe Biden is recommending you get some media training. I hope you enjoyed that clip from The Ben Shapiro Show. If you did, go ahead and hit that subscribe button so you stay up to date with all our future content.